Hello everyone, I'm Sunda, come from First Hospital of China Medical University. Today, we will learn a common clinical syndrome of nephrology together. We also call it chronic renal failure. Before we talk about CRF, we have to explain a concept cannot be bypassed first. So, let us give today's first keyword, chronic kidney disease, abbreviated as CKD. CKD is the basis of CRF, and CRF is the final stage of chronic progressive kidney disease, which seriously threatens human life and health. The etiology is complex, especially metabolic diseases such as diabetes and hypertension, which have become the main cause of chronic kidney disease in recent years, and the incidence rate is increasing year by year. The cost of treatment is expensive, with an average of RMB 10,000 yuan per year, which imposes a heavy economic burden on individuals, families, and society. Unfortunately, there is no effective means to prevent the progression of chronic renal failure so far, so we often compare CKD to the invisible killer of human health. So here is the problem. What's the key point to distinguish between acute and chronic? In clinical observation, there is an important cut-off point for the lungs of kidney diseases. This time point is 3 months, based on lots of research. So once the kidney damage is persisted for more than 3 months, we consider the renal disease to become chronic. At this stage, renal function declines irreversibly and it's hard to correct the system imbalance to develop in a good direction for doctors. Although we have used many methods, it can only delay the progression. So, what's the CKD? The definition of CKD contains 2 meanings. On the one hand, CKD means that kidney damage has persisted for more than or equal to 3 months, as defined by structural or functional abnormalities of the kidney. The damage includes such as pathological change confirmed by renal biopsy or specific laboratory biochemical markers such as hematuria, proteinuria, and so on, or imaging test evidence, whatever. No need to consider whether kidney function has decreased. On the other hand, CKD means glomerular filtration rate, an indicator reflecting renal function less than 60 milliliter per minute per 1.73 square meter for more than or equal to 3 months, regardless of whether accompanied with kidney damage. In general, both aspects may exist at the same time. In clinic, just meet one, we can get the diagnosis. Based on guidelines of the National Kidney Foundation, KIDOKI, we can get a widely accepted classification of CKD, in which stages of CKD are defined according to the estimated GFR. This table shows 5 stages of CKD. From stage 1 to stage 5, kidney disease worsens progressively. To stage 5, eGFR is less than 15 and the patients have to accept renal replacement therapy such as hemodialysis. Therefore, we also call stage 5 the end stage. So, what's the definition of CRF? The term chronic renal failure applies to the process of continuing significant irreversible reduction in nephron number and function, and the accumulation of metabolic end products and toxic chemicals, as well as endocrinal disorder. It typically corresponds to CKD stage 3 to 5. According to clinical manifestations, we stage CRF into compensatory stage, azotemia stage, uremia stage, roughly corresponds to CKD stage 3 to 5. CKD is the basis of CRF. If we compare CKD to an iceberg in the sea, CRF is just the tip of the iceberg. CKD has a large population base. It has been estimated from population survey data that at least 6% of the adult population in the United States has CKD at stage 1 and 2. An additional 4.5% of the U.S. population is estimated to have stage 3 and 4 CKD. It's to say that in North America, there are about 19 million patients with CKD, and about 8 million of them are CRF patients. Let us consolidate the knowledge points. The term chronic renal failure applies to the process of continuing significant irreversible reduction in nephron number and typically corresponds to CKD stages 3 to 5. The term end-stage renal diseases represents a stage of CKD where the accumulation of toxins, fluid, and electrolytes normally is created by the kidneys results in the uremic syndrome. This syndrome leads to death unless the toxins are removed by the renal replacement therapy using dialysis or kidney transplantation. Please remember that 1. CRF accounts for only a small fraction of CKD. It typically corresponds to CKD stages 3 to 5. Second, in the clinical classification of CRF, the uremia stage corresponds roughly to CKD stage 5, also called the end stage. However, it's worth noting that the proportion of metabolic diseases and renal vascular diseases represented by diabetes and hypertension are increasing year by year and have a tendency to surpass primary glomerulonephritis as the first leading cause. The relative contribution of each category varies among different geographic regions. The most frequent cause of CKD in North America and Europe is diabetic nephropathy, most often secondary to type 2 diabetes mellitus. Next chapter, we will learn the clinical manifestation and the diagnosis. Thank you.